Okay, so today we're going to be talking about wisdom teeth. So, what are they? They're basically the third set of molars behind your second tooth. You have two on your upper jaw, two on your bottom. They usually erupt, which means they come out between the ages of 17 and 25, so they might have started for some of us. But for some people, they can be earlier or later, or they can just never come at all. So, evolution and function. The earlier generations of humans, they didn't have like the cooking methods we did. So their foods were usually tougher, like meat, nuts, etc. That required more strength to chew, which generated mechanical stress, and then that stimulated bone growth, which is why humans back then had larger jaws to accommodate more teeth. However, as cooking methods have developed and modern diets have become softer and more processed, so less chewing is required, which means the jaw muscles are less engaged, and therefore the human jaws have evolved to be smaller. However, this has potential problems of its own. So even though smaller jaws have evolved for a reason, it can now mean that there's not enough room for molars to grow, for wisdom teeth to grow, and that can cause them to push other teeth, which leads to crowding and misalignment. And another thing that can happen with wisdom teeth is impaction. So that's when they can't fully erupt due to either not having enough space or growing at a weird angle. So there's two types of impaction, fully impacted and partially. Fully is when the tooth remains entirely below the gum surface, so it never comes out, and partially is when it's partially come out the gum surface. However, with a partially impacted teeth, there's more issues. For example, there's a flap of gum tissue known as the operculum, which grows over part of that tooth, and then bacteria, food, etc. that can get like accumulated within that gap, and that can lead to swelling and pain, which is known as perichorontitis. Extracting teeth isn't always necessary. It's important to monitor your teeth, go to regular dental checkups and get x-rays. However, in cases where it's impacted, it's usually necessary. And then partial impactions can cause cysts near the nerves. So, if it's recurrent infections or if you can just not clean it, then you usually get extracted. There's 4 stages. One's the incision. So the surgeon or the doctor makes an incision in your gum. And then it's removed either as a whole or in pieces. And then it's cleaned using sterile saline solution and suction to remove any bone fragments. And then lastly, they use dissolvable stitches, which are made of biodegradable medical materials, so that they don't ever have to be removed, because removing it again would cause more trauma. There's multiple risks of extraction. One is dry socket, which is known as alveolar osteolysis. Yeah, I can't say it, guys. That's basically, so when a tooth is extracted usually, a blood clot forms over it, so the body sends more blood to that site so that your wound is sealed. However, as you can see here, when the blood clot gets dislodged or dissolved too early, it can cause severe pain, swelling, and a bad odour or taste in your mouth. So it's really important to prevent this by, first of all, avoiding smoking, which should be like anyways, not using any straws, any like suction and swallowing, and not rinsing too heavily, because that can cause the clot to move. And then another risk, which is more rare, it's only in extreme cases, is nerve damage. So as you can see in the picture, you have 2 nerves, known as the lingual nerve and the inferior alveolar. These nerves can get damaged, and it can lead to tingling, numbness, and loss of sensation in your lips, chin, jaw, etc. However, this is usually prevented by doing proper pre-op imaging, so like x-rays before, the dentist knows what areas to avoid. And another risk is sinus issues. So this is only with the upper wisdom teeth. The root can extend into the sinus cavity, which is around here. It's known as the maxillary sinus, and this can cause 2 main issues: either sinus perforation, which is where there's like an opening between the oral cavity and the sinus cavity, and then if bacteria gets trapped in that opening, it can cause sinusitis, and this can cause, again, pain, congestion, headaches, all of that stuff. So you can see over here, I don't know how well you can see, but that green bit is where the roots are, and then over here this yellow bit is where the cavity starts, so you can see the roots are going into it. And then you have the, along with the normal like risk of extraction, which is like, you know, pain, infection, all of that stuff. And I now realise I said that way too quick, but that's it, guys.